become a nurse practitioner, you need to be a registered nurse, have 4 years post-registration experience, and you need to have a clinical master's qualification. So the preparation required for a nurse practitioner is quite varied, and it's always contextual. So you have the qualification time, in other words, the time that it takes to complete your master's, but then you have also the time to actually put that knowledge into practice.
I think when you write a reference for an application process, really look at the competencies, which is under the domains, and look at the indicators. So when you're writing a reference, you can refer to one of the indicators or the competencies, but provide an example of how you are seeing that in the practice. What has that nurse done in your area of practice where you're working to have achieved that competency? So it needs to be example driven.
If you need to write a reference for somebody who's applying to become a nurse practitioner, it's really important that all the detail is in that document. So you want it on headed note paper, you want it dated, and it needs to be current. So generally, if somebody is applying to become a nurse practitioner, we say their evidence should be probably within the 6 months prior to their application. So when you're framing up your letter, it's important to write about what your relationship is with that nurse practitioner candidate or nurse practitioner intern. So are you their employer? Are you their manager? Are you their prescribing supervisor? Are you their mentor? What's your role and what's your relationship with that person? Once you've done that, then you need to start making statements about their practice. It's really important when we're looking at nurse practitioner applications that we get a sense of the evidence behind that to support that application. So to do that, one of the easiest things to do is refer back to the nurse practitioner competencies and domains of practice to frame up your statements. Once you've made a statement, it's really important also to back it up with a piece of objective evidence, so that you're actually making a statement and then saying, and this is what I've seen in practice, this is what this person has done in practice. Because they're going to be making statements about what they do, and we need support for that statement, and that's what your job is in your reference or your assessment against the competencies. At the end of writing your letter, your attestation, or whatever it is you're doing, make sure you sign it. It's really important that these are clearly verified documents, and we do look for that when we audit portfolios or if we audit applications for nurse practitioner.
So the evidence required from the mentor or the supervisor, what we're looking for in there is objective evidence. So don't say that they're a nice person and that they're the best practice nurse you've had. That's not going to help them at all. So what you want to do is address the competencies as much as you can. So things like Jane Doe's completed new guidelines for the service, you want to say address kind of things like that, because that's the stuff that makes a difference. It's identifying how the applicant's meeting the competencies. So if you're a medical practitioner, you're going to want to address all the prescribing competencies, or as many of them as you can. If you're a nurse leader, then you might think more about domains 1 and 3, because it's more nursing specific as such. So again, you're going to want to write to the competencies and say how they demonstrate meeting the competencies. So if you're a nurse leader, some of the other things you might want to address are the professional leadership. So talking about how the applicant demonstrates leadership competence in the nurse practitioner scope within the environment that the nurse is employed in. So sometimes what we might see is that they've led service change, they've led service development, they've worked with other registered nurses, upskilling them, or they've actually led a team into working a different way with particular client groups.